back, everybody, to another edition of TCM Graduate TV. I'm Kenton Sefcik, registered acupuncturist. This is episode 43, and we're talking about my next heavy hitter, which is stomach 35. Now, we can't talk about stomach 35 without talking about knee protocol in general. So with stomach 35 in the mix, we need to talk about extra leg 5 or extra lower extremity 5, Shiyan. Of course, the best reason to use stomach 35 and its neighboring acupuncture point, Shiyan, is for knee pain. Now, I'm of the opinion that we should treat our patients with the utmost care and we should be gentle with needling technique. However, there's some times when we actually have to get the job done, such as using large intestine 15 and triple wormer 14 and needling towards heart 1. In this case, we need to use about 1.5 inch needle and direct these acupuncture points slightly towards UB40. And what we're going to end up doing is we're going to go through the tendon and we're going to go into the cavity of the knee and reduce any inflammation and basically treat any B syndrome problems in this area. Now, many people that I've found in practice, they are shy with these acupuncture points and you only use maybe 1 inch or they won't go very deep, and they're not finding that they're getting great results with this acupuncture point. However, again, if you take 1.5 inch needle, maybe a 0.25 by 40, and you do take your time to practice on yourself or any of your brave family members and practice getting the angle right, practice actually putting the full 1.5 inches within reason. We always leave maybe 2 to 3 millimeters outside that needle just in case the needle breaks. I've never had it happen to me, but I had it happen to a colleague of mine. So we're always leaving a little bit of that needle body out because where it meets the handle, there is a possibility of breakage there. So we're always leaving that out, but we're going to take that almost full 1.5 inches and we're going to put it inside the knee. Now, I have found in practice that if somebody has a lot of pain and a lot of B and a lot of inflammation in the area, what can end up happening is I won't be able to get my needle in the full way, but I'm going to try, and within reason, not causing a ton of discomfort for the patient. However, they will feel some dirty. Now, when I put the needle in and it doesn't go all the way, as they progress through treatments, I have found that the needle will go in a lot more easily. And this is kind of my prognostic, this is my tell to tell if the patient is getting better or not. So extra leg 5 is absolutely imperative in clinic for knee pain. And just want to talk about a couple other combinations that we can use with extra leg 5. So if the patient is describing pain that is all around the knee, what we can also try to add in is extra leg 1, he ding. This is also known as crane's head. Whitfield Reeves wrote a really good book on pain management, and I really like his very sound approach to treating knee pain. And what he likes to do is he likes to needle on 2 on one side, on the lateral side of the knee, and 2 on the medial side of the knee. Now, I have to warn you, I think I've warned you before if you've watched any of my videos, I'm not a very good artist. But what I'm going to do is I'm going to erase this and show you why I'm a good acupuncturist. Alright, so I think the last time I drew something, somebody commented and told me that it looked like a cabbage or something like this. So please go ahead and comment and tell me what you think this is. But anyways, this is a thigh, and this is the lower part of the leg, and this is the knee. So I've marked this as lateral, and this is medial. So what Reeves likes to do is he likes to take 1.5 inch needle and put them close to the border of the superior lateral and superior medial and etc., etc. And so he puts them on the borders here of the knee, and what he likes to do is he likes to drive them kind of down at an angle just underneath the skin, running along those tendons. And I have found if a patient tells me they have pain medial, lateral with the knee, or they've got pain surrounding the knee, an extra leg 5, an extra leg 1, they're not working that great. So Reeves protocol is kind of what I chart this as, but this is absolutely phenomenal for knee pain. Of course, to add to any knee treatment, especially if it's medial, I do like to add liver 8, kidney 10, traditional Chinese medicine style acupuncture likes to treat the area locally, and then we branch out just adjacent. So if we had any medial pain, we could do like a spleen 9, spleen 10. And the same thing laterally. Now there's not a ton of stuff around the area as far as local, so that's why these Reeves acupuncture points work really, really well. However, I like to do gallbladder 33. Of course, gallbladder 34 is excellent because it's influential of tendon. And then if we're thinking again adjacent acupuncture points, I like to do stomach 36 and stomach 34. So there you have it. Oh, one last thing before I do my spiel at the end, we also want to think about UB40. And that's a very much TCM style thing where we treat the back to treat the front. So there you have it, for real this time. Great protocol for knees. You're going to do a fabulous job. Practice putting almost the full 1.5 inch needle inside, underneath that kneecap. If you don't feel comfortable doing it on your own, find an acupuncturist or a mentor that will help you with this. It's a phenomenal way to treat the knees. Lots of other adjacent knee acupuncture points. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thank you so much for watching me. Check out the Strength of TCM podcast that I just started. Check out my Instagram feed, TCM Graduate TV, and we're going to see you on the next video.